one of our state vaccination sites that stood up. As you see the 100K balloons out there, a lot of incredible work being done. We're here today on our kind of next phase of our campaign. It's the Roll Up Your Sleeves Minnesota Families. And so the stars of this today, you'll hear from some other people today, but the stars are going to be Kendra, Isaac, and Jackson, the children of commissioners and assistant commissioners who are bringing their 12 to 15-year-olds in that now they're online. Just like last week, my son Gus took his friend Violet, and the two of them went and got their vaccine. And so we're trying to tell folks, bring your children in, bring a neighbor in, bring friends in, that we're at that phase right now where Minnesota's hospitalization rates are dropping, our infection rates are dropping, our vaccination rates are still climbing. The sooner those go up, the better we protect our neighbors, the better we protect against any potential surge coming back. And whether it be sites like the Mall of America and state sites or in clinics, in pharmacies, the vaccines are readily available within miles of everyone's home. There are opportunities right now. If you get an appointment, you can get your children in right away. Obviously, for 12 to 15-year-olds, you need parental permissions to go along with them. So that's a pretty easy process. But the sooner we get these folks vaccinated, their summers are going to look normal. We reduce the risk, as I said again, of not only them getting it, the complications that come, although be it rare, the spread to others starts to come down, and we're starting to see those numbers start to go in the direction we want them to. So another exciting day. Keep getting the message out there. I can't stress enough, as we move back towards a semblance of normalcy, does not mean this is over, but it does mean those folks who are vaccinated, who are healthy, who are ready to move on can do that. We're asking others that if you're not vaccinated, continue to mask up, follow the local guidance in those communities where you're at and the guidance they give you, and then we get through this thing faster. With that, Lieutenant Governor.
Thank you, Governor. Good afternoon, everybody. It was really exciting to walk through the waiting area, and we saw a lot of young people who had just gotten their vaccinations. We have amazing young people who are with us today doing it. Our young people in Minnesota have made tremendous sacrifices, and I think they have really experienced a lot of, frankly, trauma during this pandemic of needing to be away from their friends, not do the things that they're used to doing, distance learning. And so we know that by our young people getting vaccinated, this is one of the ways that they can get back to the things that they love. They can go on bike rides and go to grandma's house and hang out with their friends. And I know that getting a shot is not at the top of the list for summer fun activities, right, for 12 to 15-year-olds, but it will help them and others get back to the things that they love. I have an 8-year-old who is very clear that she wants to be the first 8-year-old in Minnesota to get vaccinated. And I think to have a kid who's excited about vaccinations, that just speaks to the fact that our kids and these young people get it. And for my kid who's had incidents of 45-minute negotiations before she gets the flu shot and a kicking the nurse incident a couple of years ago, I think that is a very big win. And we know that our job as parents and as caregivers, I always ask my kiddo, I'm like, what's my number one job? And she says, to keep me safe. And this is the way that we can keep our kids safe. We've got a ways to go to our littlest Minnesotans can get vaccinated, but every shot in arms helps us get us closer to making sure that we beat this thing. So I am super excited to be here. And parents, I just want to say it is easy to get your kids signed up, caregivers to get them vaccinated, and we're going to be able to do this together. And one of the folks who has been just so incredibly important to this effort, but also just as a trusted pediatrician for so many parents who are feeling nervous about a whole bunch of things, a crummy tummy or, navigating through this vaccination process. Dr. Chamillo has really been a leader there. So I would like to introduce him now. He's been the head of our vaccine equity efforts, and I am so excited to hear from him, and he can speak to these efforts as well. Dr. Chamillo.
Thank you, Lieutenant Governor. And my son no longer has a crummy tummy, so we're good from that standpoint. So, as a pediatrician, I'm really excited because I know the tremendous power vaccines have to protect our kids and our families from illness, from the suffering that comes with many illnesses, and now COVID-19 is one of those for our kids 12 and up. in my practice, I continue to see teens and younger kids who got COVID, recovered, but still have lingering side effects. They still can't quite get back to doing the things they like to do. And so the idea out there that our kids aren't impacted by COVID-19 isn't true, and the vaccines are one of the ways we can really help, again, protect them, from that potential suffering. So, my message to parents is we have a safe and effective vaccine. And I really encourage, if you have questions, that's okay. Talk to your pediatrician, talk to your family practice provider. Get those questions answered so that you can make a plan to keep your family safe and to keep your community safe. We know that not every community has been impacted by COVID-19 the same. Right? And so we've been using a social vulnerability index to really look at the impact and burden of COVID-19. And that's really a marker of structural disadvantage and structural inequity. And what we see in those areas, those zip codes of high SVI, that there's been an increased burden of COVID-19 across the population, but we've seen that with kids as well. And so kids who come from families that live in these high SVI zip codes, they've experienced 42% of hospitalizations to date due to COVID-19. And so to that effect, the Minnesota Department of Health is working with many of our partners to really target our efforts of both information and access to the vaccine to families that have been disproportionately impacted. And we're working with our COVID community coordinators, working with our COVID engagement contractors, our diverse media vendors to get that information out through trusted messengers that they've been hearing throughout the pandemic, specifically looking at messages to reach parents and to kids who are now eligible for vaccines. We're continuing to work with all of our community sites, and so we've got a number of community sites that are working to get vaccines for 12 to 15-year-olds at schools, at community centers, at places of worship, even at Head Starts this week, just trying to, again, get those 12 to 15-year-olds access to start their vaccination. We've got a partnership with the health plans that just started, and they are really targeting calling folks on Medicaid from high SVI areas, and we've given them information to help navigate some of the questions that might come up around vaccinating our 12 to 15-year-olds. And we continue to give all of our vaccinating partners information on the SVI zip codes and vaccination rates so they can really help continue to target their efforts. And so these are a number of steps we're taking to really, again, try to lead with equity in our efforts and to make sure we aren't leaving anyone behind and really bring our partners together to create a more community-driven and just healthcare system in response to COVID-19. And so I'm happy, one of our partners in that is the Department of Education, and so I'll kick it now to Commissioner Mueller.
Thank you. I appreciate that. Good afternoon, everybody. My name is Heather Mueller, and I'm Assistant Commissioner with the Minnesota Department of Education. And we are really pleased to be able to be here today. I think one of the best parts of this is to have the opportunity to have my daughter Kendra here. She just turned 16, and throughout the last probably month and a half to 2 months, one of the things that she has said over and over is that she wants the vaccine. Probably she wanted it more than she wanted her driver's license, which I never thought was possible. I think it goes to the Lieutenant Governor's point is that that's not normally what you're going to hear out of students or kids' mouths is that they want to get a vaccine or a shot. But they recognize, and what she's been able to share is that the reason she wants to do that is not only for herself, but she recognizes the impact that that has for our younger students or our kids who do not have the opportunity to do this at this point in time. She also knows that is really important for all of her peers, that she does have some friends that are not able to get the vaccine for health reasons. And so for their safety and for their protection, she feels like it's her obligation to be able to do that, and also recognizes that there are populations in our community who are going to choose not to do that, and also recognizes that she wants to be able to keep them safe as well. And as she's doing work throughout the summer, she's thinking about how she's interacting with people and with kids, and she wants to make sure that she is doing that and sees that as her responsibility. And I think that's one of the things that we're starting to see more and more is our students, our kids, the ages 12 and up, are recognizing not only their role in what that means for their families and for their families and for their friends, but it just also is a recognition of really that civic virtue and seeing what that means actually for the community at large. And as our students are starting to live that civic virtue and are recognizing their role not only in their own families but in what their communities and what that means for our state, then we are starting to see more and more students step up and take this really seriously. So I'm incredibly thankful that we had the opportunity to do this. I'm thankful that the Governor, Lieutenant Governor, and Dr. Tremolo have been able to really help to ensure that we have been able to do this in a seamless way and provide this for our students. And so if you have students that are able to do this and want to do this, this is a great venue to be able to do that. Utilize the vaccine connector. Also talk with your healthcare providers. There's a number of ways, but talk to your students and kids about it. It's one of those opportunities where you have the chance to talk to them, and they probably have an opinion. Whether that's the same as yours or different, it's still a place to be able to do that. I'm really excited to also be able to introduce my colleague, Assistant Commissioner, Dr. Sergimaki.
Hello, my name is Josh Sergimaki, and I'm Assistant Commissioner in the Minnesota Department of Corrections. And along with my colleague Ann O'Connor and a small but mighty team of state employees, we've been redeployed into the State Emergency Operations Center to help set up and operationalize and provide logistics on community testing and mass vaccinations. And I just wanted to thank the Governor and Lieutenant Governor for all the tools you've given our team to travel all across the state of Minnesota to set these operations up. I want to give a special thank you to Abby and the team here at Mall of America, the nurses, the logistics people who make this possible, and to the National Guard that's been traveling around the state with us to set up these very important testing and vaccine operations. My son Isaac is here with us today. He's 14 years old. He goes to Bloomington Public Schools, and he wanted to get vaccinated because at the bottom line is we know it's safe, we know it's effective, and we want to help improve people's lives. And a couple other reasons is sports and school. So as you'll see, he plays baseball, he plays hockey. One of the best ways to keep him on the field, on the ice, and most importantly, back in the classroom and stay in the classroom is first to get tested if you're not vaccinated, and he has been tested, including last week. And then once you're eligible to get vaccinated. So Isaac is here today so that he can continue to get back to more normal activities that 14-year-olds like to do. The second reason is we have some at-risk family members, immunocompromised. And it's really important that he gets vaccinated to help keep them safe. And then finally, like many families, we want to maybe spend some time together this summer. My other daughter, who's 18, is going to graduate. She just got vaccinated because she works in a coffee shop. Before she goes to college, we want to spend some time and maybe take a trip around Minnesota. And we want to do that with a peace of mind and a sense of being safer. So we're just pleased to be here, and just thanks everybody for coming out. I'll turn this over to Heather.
Hello, I'm Heather McGannon. I'm Assistant Commissioner of the Department of Labor and Industry. I'm also redeployed to the Emergency Operations Center and working on the mass vaccination and COVID testing. I'm here today with my 14-year-old son, Jackson, to get vaccinated. He is excited to get vaccinated because he just wants to get back to his very social and active life. He had, I've estimated, about 100 to 200 interactions on his normal daily life pre-COVID. And that, of course, all stopped, as it did for everyone else when COVID started. And as we started to get back, he's masking. We also are committed to testing. As he's getting back to that, we're still having those interactions. He's still having that interaction. So for him, it's about getting back to sports and friends and all the fun things that you do in Minnesota in the summer. For his dad and I, it is that we're really committed as parents to keep him safe, but also as community members, as citizens, to keep those in our community safe. Like Josh, I want to really encourage people who either cannot be vaccinated or those who have children under the age of 12 to consider and continue testing. We have an at-home program through the state. We also have many state-run COVID community testing sites that you can see on our website. So I encourage you to do that. Thank you.
Well, thank you. And you heard from some different voices. I think it does highlight this. This was an all hands on deck from our partners at the Mall of America, from our private industry partners, Homeland Health, others, and then the departments across the state agencies, and that redeployment of bringing in experts in logistics, experts in planning that came together as part of this team. And then, of course, like Dr. Chumalo, bringing in the medical expertise and the data experts to be able to target where folks are at. And again, to Kendra, Isaac, and Jackson, thank you. And it is modeling for your peers. I'm going to say it again. grab a friend, come do it together, get this done. Parents, it really is the stories you heard. It's about getting back to normal. So with that, any questions of this group?
Governor, on the vaccine equity issue, so perhaps this is a question for the director as well. Some people in the community, there's a pop-up site on North Minneapolis today. I went there and some people were just expressing some concern about employers not giving people time off to get vaccines.
Yeah.
So they're talking about meeting people where they are. They can't get there. Is there anything that the state can do to try to encourage and or do something that, get these people vaccinated?
Yeah, I'll let Dr. Chumlo, who's the expert in this, and this really is a big deal. And those employers who have done this, we've seen the vaccination rates go way up. We talk about these incentives. Well, some of them are, maybe they work, they're a little gimmicky, $1 million lottery or whatever we've seen in that. But what really gets people is knowing that they can take the afternoon off, or if they're not feeling good the next day, they'll still get paid and their employer will let them off. As far as transportation, trying to get them on, I know that Uber and Lyft did a national agreement with President Biden to try and get them in. And Dr. Chumlo can talk about this, about going right up to their door. But I would, again, you're absolutely right. I've said from the beginning that for a lot of folks, this isn't about being anti-science or anti-vaccination. It's being super busy, and it's about not having the ability to get right there. That's why we're trying to, as you said, meet people where they are. Dr. Chumlo, anything to add on this one?
Yeah, certainly that's a concern, and we've heard stories from other community sites where someone went and got their first shot, and then their employer got mad because they had a couple side effects and missed a little bit of time, and then they were considering whether they're going to get the second shot. And so finding ways to support the messaging to the community that there are options to talk to your employer ahead of time, have employers know that there are things like the federal program for actual tax rebates or tax breaks if they do provide that type of benefit to their employees. But we're not going to be able to do this alone. The state government can only do so much. We need our private partners to really help us here, and that is one of the ways that they can really help support the community, support us all getting out of the pandemic by supporting their employees.
As the lead on the equity issue, though, is it concerning to you to see that there are still persistent disparities in intake right now, and how much of it do you think is a distrust and you have to work to build trust versus really that access part still being out of reach even if they have a clinic in every community?
Yeah, so I think it's access in two fronts, access in information, and we know this from national surveys that when folks get information to get their concerns addressed, they're more likely to get the vaccine. And so we need to continue to find ways to get information, particularly as we go into younger ages and there might be new or different questions about vaccination. It's important that we find our ways to get information so folks can make the best decisions for their own family safety, their community safety. I think access continues to be an issue where we are doing our part in getting out into the community, but if you don't have time off work, that's an access issue, right? And if you don't feel like you're supported in your community because you're going to get labeled or ostracized, that's an access issue too. And so I think there's ways we are continuing to work to try to address access, both from the information as well as bringing the shots, or as Lieutenant Governor said, get out the vaccine. Really taking that campaign, looking at it, and getting as granular as possible with our focusing and our targeting.
Governor Walz, our friends at Breaking the News, the BTN show, wanted me to ask you specifically about, I know you kind of answered just now calling it a gimmick, but have you considered any incentives?
Yes. Yeah, this issue around that, and again, maybe the wrong word I used. I mean, your chance of winning the $1 million something, but whatever it takes to motivate people. And I think one of the things is we're really guarding against is not shaming people, getting more information, understanding that there are people who have reasons to be distrustful sometimes of the information they're getting, or have health reasons to try and get out there. So yes, we are considering those things. I do think, I don't know if there's a lot of data or research been done on it, but I think the folks in business and human psychology would tell you, if there's a chance to get something free, it might encourage you to do something. So we are really looking at it. My team's supposed to put in front of me a list of menu items that we can do, and then working with those private sectors. But I think Dr. Chumlo's point is right of understanding there are federal tax credits. There is help for businesses who are willing to do it. And what we saw is when a business invites folks in, brings information, and then trusted community folks are there with them. We saw this in Worthington, especially around the protein processing plants, that uptake number far exceeded anywhere else in the country, and it was mainly because you had an employer that was working very closely with folks who were in the community and community activists. So yes, we are definitely considering it, and this is going to be a long haul. I mean, this is months of this, and that percentage is going to continue to grow, and the universe of people who can get the shot is going to continue to shrink, and it's going to get harder and harder and harder as we get out on the end, and that's why we're going to need some more tools.
Governor, some of your peers have done not just the lottery, but free fishing licenses,
Yes.
free beer, and that sort of thing. Why haven't you done that yet? Is there a law preventing you from doing so?
We think potentially there is, but I have to tell you, that got told to me, and just candidly on one of my calls, I said we need to figure workarounds that. I think there's always, and I'm very cautious about this, I'm picking one business or something over another and using what is eventually the state's, the state itself. If I'm speaking about it, is the state endorsing this over this? I have to be a little bit careful with that. I think that we've asked our attorneys to take a look at that, because I too think we can, there may be things directly Minnesota statute prohibited, but other states are figuring out how to do some of this, so I'm asking them to do it. I think there is, and some of them are clever. I mean, we want people to be excited again about fishing licenses, which are at an all-time high. State parks. I've even seen where some colleges banded together and they're giving a free ride to one of the students in there who get it. I mean, those are, I don't know if that's necessarily if somebody's sitting there saying I'm not going to do it, but I can envision something, you got 3 or 4 friends sitting around and saying, let's go get this because they're giving free pizza if we go do it, and let's just get it done. So, I mean, all of us know the friends that gave plasma because it gave money or whatever, not out of donating blood, out of just the goodness. So we need to investigate that. I want to see us move a little quicker on that. And again, I think Dr. Chumlow's right. Our private partners, I really appreciate what they're doing, and maybe a little more of that. I mean, a gift card to go shopping after you get done. Easier to bring your team down here if they can go right into the mall and do something.
Someone, just can you just quickly describe what factors the CDC puts into the social vulnerability index? What kinds of interceptions that is?
Yeah, so there's about 15 different themes or factors that look at census tract level data, and it's looking at about 4 broad categories. One is the income and education level, one is minority and language status, one is age and disability, and then one is household, so is it overcrowded. And so it's these 4 broad themes that capture about 15 different factors that then we are able to then, and we've used it to look just at Minnesota. So if you look at the SVI kind of broadly, it's comparing, like Hibbing to Tuscaloosa, and which is more, but we're looking just within Minnesota to kind of determine where are the communities that are at most disadvantage before the pandemic, and then determining what's been the burden of the pandemic since.
Governor Walz, I have a question about the eviction moratorium.
Sure.
Is that something you are planning to put in place unless and until there's a legislative opinion?
Yes.
It seems like a sweet spot on the line on that.
Yes, and we've been asking since January. I think it's smart to have an off-ramp. I think everyone agrees on that. I think we got relatively close at different times in the legislature. There's certain provisions in there. I think one of the biggest ones is the length of time. But it's just really critical we get that right. I'm hearing both from tenants and from landlords. They want some certainty around this. This would be a really big one for the legislature now. They've got a little bit of time here before we come back in to fix this thing and take it off. But I've said from the beginning, I don't think you can just let it instantly sunset. We know that the federal government extended theirs on to try and give a date certain. But and I've said if we can reach a compromise in the House and Senate, we will certainly sign with what they come up with to try and give them that.
On a completely different note, do you know when you'll sign the medical marijuana bill? And do you think it's a good idea for people to?
Well, you know where I've stood on this, and I think it's good. I think it's a movement in the right direction around unmedicinal cannabis. My team will put it in front of me. I hope it gets some movement. I've made no made no secret about it that I don't think prohibition has worked, and I think it's had an impact equity-wise. I think it has disproportionately impacted communities it shouldn't have, and I think there's ways Minnesota could do it, and now we're seeing this across the country, especially in some of the most conservative states are moving in directions that I think we should go in. So I think in the next few days they'll have me sign it. Fun? Yeah, if you guys want, you can say no. So they're the stars. You tell them your name and
Okay, well, my name is Kendra Mueller, and I'm Commissioner Mueller's daughter. And I came here because I was the last of my friend group to turn 16, so I was really excited to get vaccinated. And I know that I'm working with kids during summer camps this summer, so it's definitely a big deal because not all of them can get vaccinated, or a lot of my friends can't get vaccinated due to pre-existing health conditions. So just making sure that I can keep them safe and my family members safe, if just kind of doing my part.
great. Well, we're going to get them vaccinated. So thank you all.
We can go over there.
Picture of a mobile van.